I work security in a mental health hospital with a general acute and children's ward. Although my job was relatively easy, it could go from 0 to 100 really quickly. The worst part was seeing patients stabilize enough to go home, then wind up back to us in another few months off their meds again. I think the thing that could really make or break a stay was the patient's roommate. None of the general ward had private rooms, so if you had an out-of-control roomie, you were in for a bad time, and sometimes there was just no other rooms for you to go to. If you were lucky enough to have family visiting and bringing you snacks and hygiene supplies, you couldn't leave your room or else they'd be stolen. Probably the most heartbreaking case I saw was one where two brothers had been severely traumatized by the murder of their sister who was neglected, killed, then put in a suitcase and set on fire. They were both basically nonverbal but stayed together for comfort in a group home. One of the brothers would act out sometimes and be brought in for evaluation and treatment. The other brother would come and stay the entire day, and when visiting hours were over, he would go to the hospital chapel and sleep there. We weren't supposed to let him stay, but I think we pretty much all turned a blind eye to it and left him snacks on the bench when he was asleep. I wanted to do so much for them, bake cookies or give them clothes, but as soon as you give something to someone, they flock to you and won't leave you alone, just begging for anything and everything. I lasted a year. It took so much out of me and opened my eyes to so much pain people suffered through. In the 90s, I worked overnight and weekend security at a center for psychiatry that cared for inpatients, outpatients, and even criminally insane awaiting trial. That area of the building was basically a prison. Police would often bring in the arrested for evaluation, and the homeless could even walk in and ask for help. We saw all kinds. I did this job for years, and some nights got very, very busy. Two scary situations really stick out from those times. The first, I was manning the front desk, and a walk-in patient holding a knife walks in screaming, "I want to off myself." He had cut himself all over his body and was covered in blood. My supervisor quickly rifled through the database and found him. History of violence against staff, AIDS, hepatitis, and more. I was commanded to put him down. I approached him with a chair as a shield. When he wound up to swing the knife at me, I rammed him with the chair until he went down. Then a bunch of staff jumped in and everybody put one foot on him until he was better, subdued, and eventually sedated. A doctor was in my face right afterwards yelling, "Did he touch you? Did he cut you?" I wasn't sure until after an examination. The second incident started when two police bring in a tough-looking guy for assessment. This guy is keeping his head down, not saying anything. I lead them to a secure observation room. The arrested and one officer goes in. The other cop returns with me to get our information and to see if he's in our database. Suddenly, my partner, who was watching the monitors, jumps up, hits the alarm, and runs